Okay, what are the major signs and symptoms you see in patients with Alzheimer's?
They usually get very anxious and they become very concerned and very self-conscious about forgetting certain things, and at times they become very aggressive.
Okay. What's the youngest age you've seen a patient with Alzheimer's?
Mid-60s, 65, 66.
So you haven't seen the early onset?
Not yet.
Okay. Do you think it's an increasing disease in our community?
Yes, I do. More and more patients are coming in sooner and we're referring over to neurology quicker. So, but their diagnoses aren't always Alzheimer's or dementia.
Okay. What do you see that people should know? What do you think people should know about Alzheimer's?
That it is hereditary, because a lot of people don't know that, and that there is a difference between Alzheimer's and dementia and Parkinson's and other neurological disorders, because they think all of those are just Alzheimer's.
What medications do you provide for your patients?
Usually Namenda and Aricept, or a combination pill that has both of those in it, and sometimes anxiety medicine.
Do you think those are effective?
They're somewhat effective, but not as effective as treating hypertension or diabetes, to where you actually have a number to measure.
Do you have any suggestions for how you should treat these patients?
With a lot of patients, and if they are starting to have increasing anxiety, we should treat that very soon, because if not, it makes them become more aggressive because they don't understand their situation.
How many patients have you treated with this disease?
So far I'm currently treating about 4 or 5 by myself, because we're running out of neurologists in the area, so I correlate with them and collaborate with them very closely on treating a lot of them. So I actually have probably about 20 that I co-treat.
Do you see a difference in people with Alzheimer's and people with other dementias?
Alzheimer's patients don't seem to have as much of the aggression as the regular dementia patients that I've seen do.
And how do you diagnose Alzheimer's?
Generally, we send them over to neurology for a specific test. And neurology does all of the testing to correlate that it is truly Alzheimer's.
And what other dementias do you see?
I see alcoholic dementia a lot from people who have drank for plenty of years. Some Parkinson's have had some dementias to go along with them. And then there's also been HIV dementia that I've treated quite a bit.
Okay, that's all the questions I have.